living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
First, the bad news. Lung cancer is the deadliest type of cancer among both men and women in the United States. In fact, 1 in every 4 cancer deaths is due to lung cancer. But the good news, tens of thousands of Americans beat lung cancer every year. Survival depends on several factors, and that's what we're going to talk about today. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back. Joining us first this morning is Marsha Hamilton, who has been diagnosed with stage 4 or advanced lung cancer. And thanks so much for being here today, Marsha, and for being willing to share your story with us.
Thank you for asking.
So let's just start out by you telling us a little bit about yourself.
Yes, happily. I grew up in Montana, and my husband and I, after we were married, went to school at the University of Montana and started a gymnastics club, which we ran for about 25 years. And then I went into teaching school. During my collegiate time, I was an All-American track and gymnast. So I had a lot of fun with both those sports and a lot of traveling.
Okay.
So that's,
and then elementary school.
Sorry, yeah,
right?
and then I went to teaching elementary school, and I did that for the last 24 years.
Okay. And so you're very athletic. You're into working out and being active. Have you ever smoked?
No, I've never smoked.
And so that's actually supposed to be a big cause for lung cancer.
Right.
And so it's crazy that you actually ended up being diagnosed. Can you talk a little bit about the symptoms that you were experiencing that now looking back you recognized, oh yeah, that was lung cancer?
You know, that's a really hard one because my symptoms involved a mild but persistent cough. And at the time I was teaching kindergarten, and most of my room had a little cough that kind of hung on. And even when I went to the doctor complaining about a cough and a shortness of breath, also I had swollen lymph nodes, they dismissed it and said, yeah, I've seen many patients today with these symptoms. Here's a Z-Pak, go home, you'll be better in 10 days. The other symptom I had, though, was a very significant shortness of breath when I was starting to try to mountain bike in the spring. And it wasn't just, oh, I'm not conditioned yet. It's, I literally can't get air into my lungs. So that was disturbing. So I ended up going back to the doctor again. And that's when I went to a different doctor, and he said, well, you know, we need to check go for a chest x-ray and see what's going on. And that's how it was found.
Okay. And then at what point were you diagnosed?
Right after that chest x-ray, the tumor was found in my left lung. The scary thing on this one is that the symptoms were very mild, and had I not been pretty physical and trying to exercise, I may not have even checked it then, because the cough wasn't much of anything.
So thank God you did.
Yes.
And then you found out what was really going on, and then there are different treatment options. How did you know which treatment option would be right for you in this instance?
So I was referred to an oncologist, and actually he's someone that my family was familiar with. His sons played soccer with my boys. I knew and trusted him and went with his opinion on what we should do. I also went to visit the MD Anderson Clinic in Houston and got a second opinion. That doctor concurred with my doctor, and so I've been following chemotherapy as well as immunotherapy treatment since diagnosis.
Okay, well, you look great.
Thank you.
How is treatment going?
Originally, my treatment went really well. After the first 3 months, my tumor had shrunk by 50%,
Awesome.
Which was excellent news. Since that time, I've seen a little bit of growth, and I had a recent scan in June that showed more growth. So we are now looking at the next plan, because chemo doesn't sometimes work forever. So we're looking at a new therapy, perhaps a targeted therapy that might fit a mutation in my type of cancer.
Okay, well, good luck with that.
Thank you.
And so in addition to treatment, have you found other support systems or other things that have helped you in battling this lung cancer?
mostly I'm going to say my friends and family have been incredible.
Good.
I had friends that stepped up right away and and my family, both my boys came home right away. My sister lives next door. My other sister is close as well. And with their support, my friends started a GoFundMe page to help me with some expenses.
Awesome.
And I've just had incredible friends and family.
Good.
Yeah.
That's great to hear.
Yeah.
So, shifting gears a little bit, in the midst of everything, you've become the Montana 2019 Lung Force Hero. What does that mean?
So the American Cancer Society does a Lung Force Hero Day every year in DC, and one person from each state is selected. I was nominated through a friend and selected to go. So I had never been to DC or really been very politically active. So it was really incredible to get that experience and have firsthand experiences with our senators and our representatives to voice our concerns and ask for help.
Okay, and so that was going to be my next question. What exactly did you do there?
We were actually given the tasks that we were to ask for when we went there, and one was to advocate for increased funding to the National Health Institute for all cancers, which everyone was on board with, and we felt comfortable with that. The other things we asked for was to push for insurance companies to not disallow coverage for people with pre-existing conditions.
Okay, really good cause.
Yeah.
And did you feel like you were listened to, or how did it go?
Yes.
Awesome.
Both senators were fantastic and really listened to my story. And actually, I had a little insurance problem at one point where my insurance decided to deny coverage of treatment that I'd already been having. One senator said, contact me if you have that problem in the future, and we can step up and help. So I felt really well listened to and supported.
Good. So we're just about out of time, but I do want to ask you, it seems like your attitude is great. You're getting out there to be an advocate for others. What do you think it is that keeps you going?
I had a conversation with my sister on the way over. Every day is a treasure to me, a real treasure. I don't know how long I have to live. I'm hoping it's a nice long time, but I don't want to waste 1 minute worrying or being sad or depressed about what I have. I want to get the most out of what time I have now, and that's what I intend to do.
Awesome.
Thank you.
Marsha, you're great.
Thank
you
you
so much for being here.
Thank you.
We do need to take a break. But coming up next, we'll learn about what puts people at risk for lung cancer, the best ways to try to prevent it, symptoms to watch out for, and much, much more. Stay with us. We'll be back in about 2 minutes. Welcome back. Lung cancer can go undiagnosed for a long time because symptoms can be ignored or pushed aside as something else. Joining us this morning is Dr. Douglas Kunzweiler to talk with us about the types of lung cancer, the symptoms to look out for, and how to reduce your risks. Thanks for being here again, Dr. Kunzweiler. So there are two main types of lung cancer, as I understand it. Can you start out by just talking about what those two types are?
Yeah, there are several different types of lung cancer, and that's based on the type of cell that becomes cancerous. But they are grouped into two main groups, and those are called small cell lung cancer, or sometimes it's called oat cell. The small cell lung cancers tend to be more aggressive, they tend to spread more quickly, and they are more resistant to treatment. The other group are called the non-small cell lung cancers, and so all the others fall into that group. And they tend to grow a little more slowly and generally tend to be a little bit easier to treat.
Okay, what generally puts a person at risk for lung cancer?
Well, the number one risk is cigarette smoking. Approximately 85% of all lung cancers are found in people who smoked. Cigarettes, cigars, pipes, doesn't matter. There are other risk factors. You can still get lung cancer even if you were never a smoker. Exposure to radon gas, which is a radioactive gas found in this area, can be a risk factor. Asbestos, especially if you worked around asbestos, is another big risk factor. Secondhand smoke is an important risk factor. If you lived in a house with somebody who was a smoker, that increases your risk. And there's probably a genetic component as well. If somebody in your family had lung cancer, you might be at somewhat increased risk.
Okay, so if those are the increased risks, how do you decrease those risks?
Well, the primary thing is if you are a smoker, to stop. And one thing that we like to stress is that it's never too late to stop. If you quit smoking, your risk begins to go down immediately, so that's important. You should have your house tested for radon gas, and there are cheap kits you can buy that will check your house. If it turns out that you have high levels of radon in your house, there are things that can be done, mostly ventilation type things, to lower that risk. Try to avoid asbestos products, and there are government agencies that can help you detect that and help you ameliorate those risks if you have it. But far and away, stopping smoking is the big thing.
So if someone is or was a smoker, or there is something else in his or her life that may put them at risk, is there a screening that a patient can go get, or how do you get tested?
You know, for a long time we've been looking for ways to screen for lung cancer, and it's really not very practical. However, if you are at high risk, that is if you have a long smoking or heavy smoking history, or if you worked around asbestos, then we recommend a low-level CT scan. It's not recommended for the general population, but if you have those particularly high risk factors, then you should get a CT scan to look to see if you have a tumor.
Okay, so those people who are not high risk, what are the symptoms they should look out for so that they should go see a doctor?
Okay, well, one of the problems with lung cancer is that it often doesn't present with symptoms until late in the disease. But the things that commonly we see are, first of all, prolonged cough. You know, usually you get a cold or a bronchitis and you have a cough for 10 days to 2 weeks, but a persistent cough that just doesn't go away, you need to have that checked out. If you're coughing up blood, that's an ominous sign, so you should see your primary care provider if you have that. Unintended weight loss can be a symptom of lung cancer, fatigue, a change in your exercise tolerance. So if you suddenly become short of breath doing things that normally wouldn't bother you, you should have that checked out. Those are some of the primary symptoms that we see.
And then if a person goes to the doctor with those symptoms, how is lung cancer actually diagnosed?
Initially through some sort of imaging, a chest x-ray or perhaps even a CT scan of the chest. If something is suspicious on that, then the next thing to do is to try to get a sample of that area that's suspicious so that it can be looked at under a microscope. And that can be done through a variety of means. Sometimes it can be done by coughing up a sample of phlegm. It can be done through a bronchoscopy, where a physician looks down inside your windpipe and into your airways with a fiber optic scope, and they can get little samples through that. Or sometimes it can be done through a needle biopsy, where a physician uses a CT scan to guide a needle into the suspicious area and get some tissue to look at under a microscope.
And then once a person is diagnosed, what are the treatment options there?
Sometimes surgery is an option if it looks like it's a small tumor and hasn't spread. Surgery sometimes can be done, and that can sometimes be curative. Unfortunately, as I said, lung cancer often presents late, and surgery really isn't an option. But there are other treatments. There are various chemotherapy treatments. Radiation therapy can be used. Some of the lung cancers are susceptible to radiation. And there are newer treatments that are called targeted treatments, where they use antibodies to attach to a chemotherapeutic agent that then goes directly to the tumor cells. And so there's a lot of exciting new research in treatment.
Very cool. All right, we're actually out of time for this segment. We need to stop and take a quick break, but thanks so much for all that information, Dr. Kunzweiler. Coming up next, when a person is diagnosed with lung cancer, getting the right care and support can be critical in battling the disease. We'll talk with a healthcare professional who helps make all that a little easier. Don't go away. We'll be right back after these messages. Thanks for staying with us. Care for serious illnesses such as cancer can be complicated, and when patients are having to deal with the battle of a lifetime, it's comforting to know there's an advocate fighting right there beside them. We are now joined by Jamie Wilcox, a lung nurse navigator. Thanks so much for being here today, Jamie.
Thank you for having me.
So let's just start out by talking about what is an oncology nurse navigator.
An oncology nurse navigator is a clinically trained professional that's there to identify and remove barriers so that patients can receive timely and appropriate cancer treatment. We're also there to guide them through the entire process from diagnosis on through survivorship.
So you said professionally trained. Can you talk a little bit about what an oncology nurse navigator does as far as education and training for that position?
Right, so we usually have quite an extensive background in oncology, and most oncology nurse navigators will be oncology certified. In addition to that, the Oncology Nursing Society has a set criteria or core competencies, if you will, of whether that's with the professional role, providing education with the patient, care coordination, and communication with family, other providers to make sure that we get them through the process timely.
So can you give some examples of what you or a nurse navigator would do for somebody who has been diagnosed with lung cancer?
It really depends on the individual and what their needs are. A lot of times when I meet them at the biopsy, it might just be education about what to expect with the biopsy and reinforcing what the doctors probably already told them. And then just answering their questions and letting them know I'll be watching for the results, and we'll get them in as soon as we have them because they're usually most anxious about what those results will be.
Sure.
If I don't meet them till the actual consult with the oncologist, we can provide them when, being that it's a very stressful situation and they hear cancer and that's the last thing they hear, I can be there to take notes for what the doctor's telling them so that they can refer back to those later and be able to process everything that they were told at that visit and answer questions for their families, and then guide them through their next steps, making sure they get appointments at a reasonable time frame, get them scheduled so that we can get them started on their treatment.
Can you talk a little bit about how someone can find someone like you? If someone's been diagnosed with cancer, how do you find a nurse navigator?
That's a great question. Not every hospital has nurse navigators yet. It's still a relatively new role to nursing. But most places are coming on board with that. And so really just talking, if you haven't already met a nurse navigator, just talking to your provider and asking if that's a service that's offered. That would probably be the easiest way.
What are some of the common barriers that patients and maybe their families too might run into that you help remove for them?
A lot of it's just education. They're new to the healthcare system and how it works, and making sure that they understand what's happening, what their next steps might be in the process once they get the diagnosis of cancer. It might be financial or lack of health insurance, or their health insurance doesn't cover certain things, or just finding out what their deductibles are or do they need help with that. So getting them referred and set up with the appropriate system in the hospital to help them with that financial burden. It might be a language barrier, making sure that there's an interpreter there so that everyone, so that we understand what the patient needs, the patient's understanding what we tell them. It could just be transportation. Being in Montana, sometimes the weather's not great. And so they might not have a very reliable car. And do they have other sources, friends or family members that can give them rides? Or do we need to look into getting transportation set up for them? It just really depends on the patient. But anything that we can do to get them to their treatments and give them a good quality of life during their treatments is what we try to do.
And that is a lot, and it's really great. But let's talk a little bit too about the emotional and mental well-being of a patient who's been diagnosed with cancer. Do you help them figure out how to even cope with that diagnosis?
We do. A lot of times we're just a sounding board for the patient, but then at times we need to recognize when they might need more assistance than just a nurse navigator, and so making those appropriate referrals to social work, who we work very closely with in our hospital. Participating in distress screenings with the patients to find out what it is that concerns them the most and how we can go best about helping them, so that that's not a stressor and that they don't have to worry about that, and they can just worry on getting healthy.
That is great. And you already mentioned financial, which can also be a stressor. Can you talk a little bit about what you do to help folks navigate the financial part of care?
Unfortunately, I can't do too much other than get them out to the appropriate referral so that they can find out, do they have a deductible? How much is that deductible going to be? Making sure that they have a financial advocate, making sure that the prior authorizations are being done appropriately so that they don't get a surprise bill in the mail and then start to worry about how they're going to pay for that. But mostly it's just getting them hooked up with the appropriate person that can help them through that process.
Okay, and do you help the family too? Do you support them, and how?
Absolutely, and of course it's with the patient's permission that we can talk to the family, and a lot of times they're already at the visits with the patient when they come in to see the doctor, and we encourage that because it's always great to have an extra set of eyes and ears as to what's happening at those visits. But we do provide information booklets on how they can read that discusses how they can best help their family member going through this process. And also we can refer them out for counseling or social workers to help them through that process. A lot of time, if it's small children or if it's the parents of the children adult children going through treatment, that there's always a different dynamic. So we do offer that as well because they're all part of the whole package.
So we probably have time to just one more quick question. For folks who don't have a navigator, are there resources they can reach out to? Any advice there?
Yes, I would be wary of the web.
Okay.
When you go onto the web, please pick appropriate and well-known websites like the American Cancer Society or the National Comprehensive Cancer Network or even the Lung Foundation. They all have very good information. It's evidence-based and it's consistent. But there are, depending on what city you're in, there'll be support groups. A lot of times some of these websites like the Lung Cancer Foundation will have online support groups. So if you're in a very small rural area, you still have access to that sort of support.
Perfect. Jamie, thank you so much. A lot of great information. We appreciate your time and expertise.
Thank you.
And thank you so much for watching at home. We hope you'll tune again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.